Assalamu alaikum, I'm Dr. Tahira and you're watching program Health is Wealth. It is October and October is the month of the pink ribbon, breast cancer awareness, a very important topic. That is why today we are going to talk about breast cancer as well as other cancers, their timely detection and save lives. Assalamu alaikum, welcome to another episode of Health is Wealth. It is October and October is all about the pink ribbon. The pink ribbon or breast cancer awareness. Why should we be aware of breast cancer? Breast cancer is one of the most prevalent cancers in our country. It is extremely important to detect cancers on time so that they can be treated. Today we have with us Dr. Kashif Khan. He's an oncologist, a cancer surgeon specializing in breast surgery. Thank you so much for joining us. It's October and it's not just confined to October. I think we have breast cancer all year round.
Yes.
What is the incidence of breast cancer in our country and how many women or men come to you at the right time?
Generally, if we talk about the incidence of breast cancer in our country is relatively higher than our neighbors. 1 in 9 women will get a breast cancer in their lifetime, so it's a very common problem.
What could be the reason? Why is it so common in our part of the world? Or in our country specifically?
Actually, it is more common in the Western world.
Okay.
If we look at our region, within our region, it's more common in our country.
Okay.
It has something to do with the genetics, it has something to do with the environmental exposure. These are the likely causes, but for our environment, our country, understanding what has led to a higher incidence, it is difficult to say with the limited data, but it certainly has something to do with the genetics and the environmental exposure.
What are the possible causes of breast cancer? For example, people say that there are different kind of things that are carcinogens. Does tight clothing or hormonal replacement therapy or oral contraceptive pills, do they play a role in actually having breast cancer or developing breast cancer, or is just family history?
Actually, breast cancer, if we talk about the cause of breast cancer, the cause of breast cancer is actually a genetic mutation. Okay. The chances of it become higher if there are certain risk factors. These risk factors include increasing age, it is the female gender, and then strong family history, genetics, and these are the risk factors about which we can't do much. Right. And then there are risk factors about which we can do something. These include smoking, these include use of alcohol, then obesity, increased weight, and then we have got the diet. There are certain diets, the more the food is processed, the higher is it is carcinogenic. Okay. And in addition to diet, the level of physical activity that an individual is doing, the higher the level of physical activity, the less are the chances of developing.
So I think this might be the reason, because we have a very sedentary lifestyle in our country especially. We don't move around as much. Yes. And then we have a very processed diet full of this refined flour and everything. What about radiation, exposure to radiation, unnecessary exposure like repeated x-rays and all of that? Does that play a role?
That does play a role, but majority of the cases are not exposed to the radiations. Majority of the cases are, we must understand, hormonal exposure is one of the reasons. Hormonal exposure for the ladies is that they start getting exposed to the hormones when they reach the age of menarche, that is when the periods start, and it ends when the periods end. And during this time, females actually go through a number of changes, that is the monthly changes, and then pregnancy, and then feeding the babies.
Exactly.
The feeding the baby for 2 years is helpful. It reduces the risk of breast cancer. Having a pregnancy, it gives a gap of 9 months to the exposure.
So it's good actually.
Yes, it's good actually.
So that means that breastfeeding is extremely essential for the women's health, and it is a myth that the breastfeeding will actually destroy the woman's health. It will actually improve it.
Yes, it will improve it. It reduces the incidence of breast cancer. It is a natural method of family planning, which gives the ladies a gap between the kids. So it is extremely important.
So this is what we should do to reduce the incidence of breast cancer.
Yes.
Now, how do we detect breast cancer? If somebody has, what are the changes in the breast that one must look for? How do we examine the breast? And what are the apparent symptoms of that we need to look out for?
Yes, we are talking about these because we want to know early about the breast cancer. We
the
don't
earlier
want,
the better.
Yes, the earlier the better are the results. So most of the patients come to us with a lump in the breast.
Okay.
This is the most common symptom. Whenever a lady, whenever she feels a lump in the breast, she should consult a doctor. The lump is generally not painful.
Okay.
It slowly increases in size, and in addition to that, the females can feel there is some change in the breast shape, appearance, or symmetry of the two breasts. This
Okay.
can be noticed. Then there are certain skin changes of the breast. That is, the skin can become red, it can
Okay.
become swollen, it can become like orange peel. So these changes can take place. The skin can also get dimpling, it can get pulled
Retracted
inwards.
inside.
At the same time, we need to have a look at the nipple areola as well.
Right.
The nipple can be, its skin changes can take place, there can be nipple discharge, the nipple can get pulled inwards. So these are the common symptoms with which patients come to us. In addition to this, the ladies can also come to us with the lump in the axilla, but
Okay.
when there is a lump in the axilla, it is a relatively advanced stage.
And can it be possible that there's a lump in the axilla but they don't have any such symptoms in the breast? Is that a possibility?
Yes, this is a possibility.
Okay, that is very scary then.
This is less common, but
Yeah.
this is a possibility.
When we talk about changes in the breast, what other conditions could be confused with, for example, breast cancer? Like, for example, somebody having mastitis or pain, or what are the other conditions?
Actually, it is the lump breast which makes the ladies very fearful. So one thing to be clarified is that most of the lumps of breast are not cancer.
Okay.
Majority of the breast lumps are not cancers. So, but any of the breast lump needs to be evaluated in detail. So there are many other problems, particularly in young females. There is one thing is called fibroadenoma, which comes in the form of a lump. This is a very benign condition. This is not harmful at all. Then there are other conditions. Nipple discharge in middle ages is because of other reasons such as involvement of the ducts.
Okay.
This is totally a benign, non-cancerous condition. So majority of the conditions of the breast are not cancer, but we should be vigilant that we don't miss the cancer.
So this is self-examination, but how
Yeah.
do we go beyond self-examination? For example, if a woman does feel a lump somewhere in the breast or she has some kind of suspicion, what does she go for? A mammogram? Should she go for a mammogram? How frequently should you go for it? Are there any other tests, for example, blood tests or tumor markers or gene tests that would tell her that she is at which stage, and like without visiting a doctor? I mean, she has to visit a doctor, but before visiting the oncologist.
So before visiting the doctor,
I mean, the oncologist, the specialist.
Actually in that scenario we need to understand that there are two imaging modalities. One is ultrasound and other is mammogram. Mammogram becomes helpful after the age of 40 years. So doing a mammogram, routine mammogram at the age of 40 years is recommended.
And do you suggest it to the women who have a family history, who are obese, who have some kind of suspicion, or to every woman above the age of 45 or 50?
So when we talk about early detection of the breast cancer, number one thing is awareness, which we are trying to raise now. Then comes the breast self-examination, which ladies should start at the age of 20 years. And they should do it on monthly basis after their periods end. Then they should do the breast self-examination. There is a scheme to it. The ladies should get familiar with their breast so that when there is a lump, they should be able to feel it. So throughout the time, they will keep on examining their breasts, and by the age of 40, if there is no family history, there is no issue, all the ladies at the age of 40 years should get a mammogram done.
Okay, so they should get a mammogram done. And for example, if something is detected, could you tell us what are the stages and the grades of cancer, and at which stage is it more easily, treatable, and what are the treatment modalities available?
Actually, the treatment modalities include surgery, chemotherapy, radiation, hormonal therapy, and targeted therapy. These are the treatment options. The earlier the diagnosis is made, the higher are the chances of the success. So if a diagnosis is made really early, many a times just doing the surgery may be enough, no other form of treatment. So by making a diagnosis early, we can save lives. By making a diagnosis early, we can avoid unnecessary treatment, which is chemotherapy in some of the cases,
radiation,
or radiation, or targeted therapy. These can be avoided. And as far as surgery is concerned, if an early diagnosis is made, instead of removing the whole of the breast, we can perform a breast conservation surgery in which only the breast lump is removed, the cancer is removed, and the breast remains over there.
So when you remove a lump or a lumpectomy, there's not much disfigurement, and it's an relatively easier surgery for recovery as well. But what do you suggest to these people? Is there a chance of it coming back, or is there? And how often does it relapse?
Actually, there had been extensive research on this.
Okay.
They have been comparing the results of removing the whole breast and doing the breast conservation surgery only. So, breast conservation surgery plus radiation, which is very convenient, equals mastectomy, that is removal of the whole breast. Yes. So, the results of both the modalities are now similar.
All right. But how often does the thing come back, the relapse? Like for a breast cancer, even if you have done a complete mastectomy, are people able to survive their whole life, or is it?
If it is a early stage tumor, the survival is more than 90% of the patients are totally cured.
That's very promising for everybody, so that all the women out there. What about the taboo regarding this? Because a lot of people, a lot of women are very scared to, especially when they're not married or something, they're very hesitant or scared to go forward or tell their families or share this information with them, or even go to a doctor. So what would your message be to the young girls out there, especially if they detect something similar?
Actually, my message would be to the young girls and the old girls as well, because the family members who are responsible and who have the authority, ultimately they get the authority. So it is the responsibility of them to discuss with the younger ladies and encourage them. If there is any problem, they should come up and let them know, and they should accompany them to the doctor or seek the treatment. And in addition to this, we should talk about it. We should talk about it at all the forums. We should engage all the segments of the society, ulama, the school teachers, awareness sessions at schools and colleges and universities, and at the offices, at media, at social media.
Everywhere, so that they know that on time, if they are going to detect it, it is treatable. What about reconstructive surgery options after that? Because there's a lot of fear that they will look, they would not look normal, or they will not be accepted into marriage or whatsoever, or how their life can be afterwards. Can they bear children? Can they not? What are the, once you get the treatment, for example, it's a mastectomy or a radical mastectomy, what are the options of a normal life after that?
Actually, if we look at the stats, generally it is less common in younger population. So before marriage it can happen in younger ages, but it is very less common. And as far as the mastectomy is concerned, removal of the whole of the breast, it can be reconstructed. There is no issue about it. It can be reconstructed. It's a procedure that can easily be performed, and it is a relatively lengthy surgery. It takes a few hours of surgery, but there are many reconstructive options available.
So when we say that something has reached stage 3, so the size has increased and it has metastasized to different organs in the body, or the lymph nodes are informed, then what are the treatment options, and is there a chance of survival then or not?
Stage 3 is again a very much treatable condition.
So it's only stage 4 that is
stage 4 with latest chemotherapy and targeted therapy and other agents. Even stage 4 is quite a manageable condition.
That is a very good and promising news. I think many people don't know that, because the moment they hear that it's stage 3 or stage 4, they just give up.
Yes.
Right.
I still, under my follow-up, there are many patients who have got stage 4 disease. The disease was under control on chemotherapy and targeted therapy, and they ultimately, the disease remained stable. They ultimately came to me for the surgery. I performed the surgery. They are still on follow-up. So stage 4 disease is not loss of hope. We are talking about breast cancer not only because we want to detect it early, because
it is treatable.
Yes, it is treatable. There is
so that is why we keep talking or stressing more about breast cancer, and all these awareness sessions that we get to hear and visit, is because that it is something treatable. You don't have to fear it or think that you're going to die because of it, right? So it's not a monster as it seems.
Yes, and so coming back to the stage 3, which was your original question. Stage 3 breast cancer is that cancer which generally is large in size, or there is a lump in the axilla. This is the stage 3. It has not gone beyond that.
So it has not metastasized to the bones or the brain
lungs or brain. It has not gone over there. This is the stage 3 breast cancer. In stage 3 breast cancer, in general, our approach is giving the chemotherapy.
And the lymph nodes as well.
Giving the chemotherapy first.
Okay.
After the chemotherapy, then we do the surgery. A few years ago, it used to be a routine that whenever diagnosis is made, patients used to go ahead with the surgery first and then chemotherapy. Now we have better results in stage 3 with chemotherapy first, then surgery, then other forms of treatment.
All right. What about people in menopause, like ladies in menopause, should they be taking hormonal replacement therapy? Does it play a role in having, in inducing breast cancer? And also women who are on oral contraceptive pills, is it advisable for people on PCOS or even otherwise to take these hormones, or it's not, these synthetic hormones available in the market?
Actually, oral contraceptive pills are very low in hormones.
Okay.
So it's not beyond doubt that they increase the risk. Most of the oral contraceptive pills do not significantly. So
Okay.
oral contraceptive pills should be used whenever they are required.
Okay,
As far as hormonal replacement therapy, it should also be used. It slightly increases the risks, very slightly.
Okay.
So we should be
not
a
very
bit careful, but it's not a no.
Okay.
Hormonal replacement therapy, when it is required, it should be used.
So, Dr. Kashif, you are a breast surgeon, but you're also an oncologist, a cancer surgeon in general. So, let us come to the other kinds of cancer as well, which are very prevalent in our part of the world, especially in our country. And let us start with colorectal cancer for that matter, because I've heard the increasing incidence and how you keep missing out on it. What are the symptoms? What is the incidence?
Incidence is quite high. So, lung cancer in ladies, it is the breast cancer. Then we come towards the colorectal cancer. This is the incidence. In our part of the world, oral cavity cancer comes at number 2, and it is generally number 3 or 4 is the colorectal cancer. But colorectal cancer again is one condition which is very much treatable. And colorectal cancer, in common words, badi aant ka cancer. So that people. So colon cancer, colon is a big part. So colon cancer can be divided into right and left.
Okay.
The left-sided colonic cancer is the cancer of the last part of the colon.
Okay.
That comes generally with the bleeding that comes with the stools.
So, the stools are dark, or do they have frank blood in it?
They can have frank blood. If it is very low down, the blood may not be mixed with the stools. It may come separately.
Okay.
As we go higher up, it keeps on getting mixed.
And it looks like a dark, the stool appears dark, right?
Yeah, a bit dark. But if the stool is totally black, then it indicates exposure to the acids which are there in the stomach. So if these are black stools, it indicates that this blood is coming from stomach. So that may be a sign of the stomach cancer rather than the colonic cancer. So one is blood in the stools. Patient complain of passage of mucus.
Okay. So it's foamy, frothy?
It is foamy, frothy. It is sticky material that comes out. And then patients report an change in their bowel habits. It is sometimes they get constipated, increasing constipation, then they have an episode of diarrhea, then again constipation. The patients can report of weight loss.
Loss of appetite.
Loss of appetite. Then we come towards the right-sided colonic tumors. The right-sided colonic tumors generally come with bleeding, which is very slow.
Okay.
This slow bleeding results in anemia, which results in weakness. So patients come, many of the patients. So if a male patient has got a low hemoglobin or comes with that I used to walk, I used to walk this much of distance, now I feel breathless. This is the most common symptoms. Then again they can have, they can feel a lump in the abdomen, or they can have increasing constipation. So these are the symptoms of colorectal cancer.
And what about bloating? A lot of people have a lot of bloating these days, and then they have reflux as well. Do these things correlate with them, or they don't?
Actually,
like IBS, people confuse IBS a lot with these symptoms, right? So how do they know that it's not IBS, and it's which investigation should they go for?
First, if I talk about symptoms, in IBS we do not have blood in the stools.
Okay.
There is not that much of mucus discharge.
Okay.
Generally there is no weight loss. So these, and then on the basis of investigations we can differentiate between the two.
And what are those tests, like a complete blood report and then stool culture? What would you do? A stool report?
In the stool we have different tests that can detect if there is any blood or not. If there is no blood, then generally colon is fine.
But and what about an endoscopy or a sigmoidoscopy or a colonoscopy? When should they go for that?
Actually, whenever there is, when anybody notices blood in the stool, this is a significant sign.
And it can be detected on these tests?
It can be detected on these tests. So, whenever there are symptoms which are suggestive of colorectal cancer, the patient should get a colonoscopy done. Colonoscopy is we put in a scope, we have a look at the whole of the colon, and since the colorectal cancer starts from the inner lining of the colon, so it is easily seen on colonoscopy.
And if somebody has colorectal cancer, for that instance, then what are the options? Do you resect the entire intestine, the part of the intestine, and how is the prognosis?
Prognosis is generally very good. It has got an excellent prognosis. The treatment strategy is that for the colonic cancer, rectum is the last part of the colon. So the proximal part, the earlier part of colon, the first option is doing the surgery. So we remove the diseased part and then we join the colon together. That is the surgery that is done. In case of rectal cancer, we give chemo and radiation first, and after chemo radiation then we perform the surgery. Same principles, we remove the affected part of the rectum and then we make an anastomosis, we join the two ends together. And this surgery, nowadays we are doing this surgery laparoscopically.
Okay, so you don't have a very big incision and it's bloodless and painless and heals faster.
Heals faster. It is minimally invasive surgery. The patients get only small cuts, and through these cuts we put in camera, we have a look, and we have a look all over the abdomen, and then we remove the disease part, and it has got a relatively quicker recovery.
When we talk about colorectal cancer screening, especially for males that are above 55, how often do they need to get it done, and what are the methods of screening? Like, what do they do in a screening test so that they know that they're free of this cancer?
At least all the males at the age of 50 years should get a stool test done for detection of any blood in the stools. At least. In UK, they have guidelines that every individual at the age of 50 years should get a colonoscopy done.
So it is mandatory, and it's every year, every 3 years, 5 years?
Then depending upon the findings, then 3 yearly is the general plan. It can be done earlier if we pick some polyps.
And why do we think that we have so much of colon cancer in our part of the world? Is it our diet again, or our exercise routine, or what is it?
If we compare ourselves with the Western world, the incidence of colorectal cancer is relatively low. It is very high over there. But still, it's a significant cancer in our part of the world. It is treatable. It can be detected easily. So it should be managed. And
I think it's a refined diet again, right?
If we talk about the risk factors, what are the risk factors? If we look at the risk factors, then again it is our diet. It is the processed diet again, and high protein diet, taking less of the fresh fruits and vegetables.
Less of roughage and more of these.
Roughage is important. Greens are important. These are all protective agents because they increase the actually volume of the stools. When the volume of the stools is increased, the exposure, the transit time is decreased, and the
so there's less chance of them irritating.
Yes.
If we talk about stomach cancer, let's come connected to the colorectal cancer. So what are the symptoms of a gastric cancer, and how do you not confuse it with gastric ulcers, H. pylori, all of those symptoms, GERD, and how do you know, no, this is gastric cancer, it is something that is actually serious and requires immediate attention?
Actually, detecting a stomach cancer is
very hard.
Very difficult. It is a difficult thing because the initial symptoms, the symptoms at the early stage are very subtle. It is so any discomfort, dyspepsia or indigestion that happens after the age of 50 years should be taken seriously on the basis of the patients can also complain of that early satiety, that they get filled very early. They take only, they are feeling hungry, they take small amount of meal and they feel full. This is also a symptom, early symptom. Then there come the late symptoms, which is vomiting, which can be, there can be blood in the vomiting. Some of the patients can get dark stools, that is, it is bleeding over there. Yes. And then again the same symptom, that is, it is bleeding slowly and it is causing a low hemoglobin level. And then in that situation again shortness of breath and becoming breathless are the symptoms.
So, and how do you detect it? Like, what are the tests for the stomach cancer?
For the stomach cancer, if it is suspected, then we should do an upper GI endoscopy. We'll have we put in a scope. We have a look on the inside of the stomach. Generally, we are able to make it.
And the treatment options are resection of that part of the stomach?
Yes.
Okay.
The mainstay of the treatment is again surgery over here. If we recently we have changed the strategy a bit. The recent guidelines suggest that these patients should be given chemotherapy first and then should be operated. And then we can again give a few cycles of chemotherapy, and the results of stomach cancer are also improving, but it still continues to remain a challenge detecting it early and offering good treatment.
Why did you say that oral cancer is so much rampant in our country? Is it because of the, the tobacco and the betel nut and all these habits that we have of every region? For example, we go to Karachi, we have betel nut. If we go to Peshawar, we have the tobacco over here. We tend to keep something in our mouth, and then our oral hygiene is extremely compromised, and we constantly keep irritating our oral mucosa. So it is that rampant?
So the inner lining of the oral cavity, the mouth inside, that when it gets irritated over the period of time, there can be changes in it which can turn into a cancer. So all these irritants, the betel nut and the naswar that is in this part of the country, and as we move.
And nowadays we have that newer thing, that little patch, what is it called, velo or whatever that they put inside. That's even more dangerous, right? It's a more fashionable version of the same rubbish, actually.
Yes, exactly. And it is being sold these days.
Very glamorized, in a very glamorized fashion, with all the latest stars and celebrities endorsing it.
Yes.
So could you tell our youngsters how lethal it can get?
It is very bad, actually. It will. It is extremely bad, and it is totally unsafe. And this is alternating, replacing
one evil
bad.
with the worse.
Yes, even worse. That's I think that's worse.
Yes, it is worse. It is not even in the organic form. It's more of a synthetic pouch, I think, that they
synthetic pouch, and they are putting it over there, and it is, I think, more of an irritant.
Right. So what are the symptoms of an oral cancer? Do they bleed that place? It's a eroded wound. How does it appear initially? And what do they need to do? Like, what are the treatment options? Getting the
It is generally a wound. There appears an ulcer, or
that doesn't heal.
That stays there, and there is no apparent reason for it, and there is no ill-fitting denture or a tooth that is irritating that area. And there is a in most of the patients. In most of the patients, there is a history of the betel nut smoking, all these things. There is a history that it will be there on that particular side. If you ask these people, they will tell you, I always put it on this side, and it will appear on that side. So it's quite obvious. We need to get a biopsy of that area. We take a small sample from that area and send it to the lab, and then we are able to make
and then what do you do? What is the surgery? Like, you have to remove that entire part? And how disfiguring can it get? I want you to scare our youth out there, because they're the ones watching this program, majority of them. And they think it's very fashionable and very in to do that.
That's a horrible situation, actually. We need to not only chemotherapy, it requires radiations, it requires surgery. Once this area gets radiated, you always have to, there is a big disfigurement in this area. Sometimes we have to remove this bone, the mandible. This is called mandible. We have to remove.
And then they can't be normal in their mastication.
Yes, we replace it, but it can't be that normal. We have to do neck dissection. We have to radiate the area. After the radiation, this area becomes dry very early, so they always have to move with a water bottle, and it's a constant, it's a huge problem even if we cure the disease.
Okay, now let's move to lung cancer, which you said is also very prevalent thanks to our smoking habits, and then we have pollution, and we have a very, very unhealthy environment. We don't clean our cars, and we have a very bad,
air quality.
Air quality.
And upcoming months are going to be horrible.
Yes, they're always horrible now.
Yeah.
But
No, from air
smog
quality
point of view, smog
from
point
air
of view, yes.
quality's
The-
point of view,
the
and
smog will be there all
Yes.
over us, looming over us, and especially areas like Lahore. I've heard that they are the worst in the world now.
yes, we are
We are
leading.
first in that. Yes.
Yeah.
Okay.
So even Islamabad is going to be bad.
Yes, thanks to our burgeoning construction
Yeah.
every day. But so what do we do about it? We can't run away from here. So what do we do?
Actually, these all factors lead to lung cancer. There is no doubt about it. We need to decrease our exposure to the open smoke. Do not do smoking. Avoid your exposure to the outside, particularly in those days when the
Okay,
air
the
quality
smog,
is very bad. Particularly the month. It generally starts in the mid
December, I think, right?
December.
Yeah.
Yes, it starts in the mid of November or
Early
at
December.
least in the on the 1st of
So
December.
what are we
it's-
supposed to do? We can't wear a mask and go. And what are we supposed to do then? Move
We
to
have
some
to.
other area? What do we do? But we have to work here. How do we fight this poor air quality? Or how do we? Okay, let's talk about how do we purify the air inside our house?
Actually, generally the air inside the house is better than the air outside overall, in particularly those months,
Okay,
December
that's
and
good.
January. So keep your windows closed when air quality is bad. Don't let that bad air come inside. The air that is inside, with time the particles settle down and its quality generally improves. And to add to that, we are heading towards a point where we need air purifiers in our
Yes,
rooms,
we do.
particularly the bedrooms where we
Right.
sleep. There should be air purifier.
Should we have indoor plants? There is a lot of,
Yeah.
the people are saying the snake plant and this plant and fern plant is good for you indoors so that the air quality improves.
Yes, no
Okay.
doubt about it.
Okay.
That's a definite yes. That is a very good alternative to the air purifier which
Okay.
I was talking about. That should be the first step, and these are extremely
So I
important.
think we should all be doing that. What are the symptoms of lung cancer? Is it the cough, the sputum? How does it present? And what is when do you detect it? How do you detect it? And what are the treatment options? We can't be replacing the whole lung. So what
Yeah.
are the treatment options with it?
Actually, lung cancer appears with a chronic cough.
Okay.
And with the cough there is sputum, and
Blood.
within the sputum there is blood. So any cough that is patient is coughing out blood, that should be taken seriously. And if there is relevant history and age goes, then we need to do a CT scan of the chest, and in some of the cases we do a bronchoscopy. On the basis of the bronchoscopy, at the same time they take a biopsy, or we can do a ultrasound or CT guided biopsy if it is close to the chest wall. On the basis of that, the diagnosis is made, and many of the cases, rather majority of the cases, are detected late, and in many of the cases we can't offer a
too late.
curative treatment option. But there are many cases in which still surgery can be an option, still chemotherapy followed by surgery or followed by radiation can be an option. So it's not a loss of hope in all of the cases, but there are many cases in which we can actually offer treatment.
Okay. So Dr. Saab, very recently I've heard a lot of cases of pancreatic cancer. So how common is that? Because I don't know why so many people lost their lives lately due to this. I hadn't heard it so much in the past, but recently I'm hearing a lot about pancreatic cancer. What are the causes, what are the symptoms, and then what are the treatment options?
Actually, if we talk about the symptoms of the pancreatic cancer, most of the times when it is detected, it comes with jaundice, the yellow discoloration of the eyes and the urine.
Okay.
That is the most common presentation. But we want to detect it earlier. So an upper abdominal discomfort, dyspepsia, a new onset of diabetes,
Okay.
these are all factors. Any weight loss, all these factors are which should raise our concerns. But certainly whenever there is jaundice or yellow discoloration of eyes, it is a warning sign of the pancreatic cancer which should be looked into.
And is it treatable? Or-
It is treatable if it is detected early. Many of the cases get detected early. It's not a total loss of hope. Many cases.
So what is the test, the lipase, or what test should be there?
Actually, these are blood tests to look for inflammation of the pancreas, to look for if there is any lump in the pancreas. Generally, the first investigations we do is we do a blood count, we do liver function tests, we get an ultrasound done. Then on the basis of this, we go ahead with a CT scan. On the basis of CT scan, generally we are able to see it. Then we do an endoscopy. On the basis of endoscopy, we are able to take brushing cytology or sometimes some needle samples, on the basis of which we are able to make the diagnosis.
Okay. So there, when we talk about skin, a lot of patients that come to me, they have a generalized itch on the body, and unfortunately a lot of dermatologists keep prescribing them steroids without ever thinking that it could be a lymphoma, and in most cases it is a lymphoma. So could you please tell people about lymphoma, Hodgkin's and non-Hodgkin's lymphoma, and how it's a very good cancer to have because it's easily treatable, and these symptoms that they should not be confusing with different specialities and going there and getting themselves, and because most of them unfortunately practicing are not even dermatologists, they claim to be so. So could you please shed some light on this?
Actually, lymphoma is the cancer of the lymph nodes and the lymphatic system.
Right.
This lymphatic system can be present in the skin. So any skin lesion that is not healing, that is not responding, we should get a biopsy done on that, and on the basis of that, diagnosis can be made. Lymphomas generally come with enlargement of the lymph nodes. So any lymph node that has increased in size and stays there a few weeks and there is no probable cause, we should get an ultrasound done. On the basis of ultrasound, there are certain features. It becomes more of a round rather than a beam. Then we and its size increases.
And what about this low-grade fever, night sweats, and those kind of things that they need to look out for?
Yes, these symptoms of low-grade fever with an evening rise, with feeling of sweating and some weight loss. These are all the symptoms which can be at times confused with the tuberculosis. So whenever this situation arises, we should take the biopsy. If it is the skin biopsy. If it is in the lymph node biopsy. And the good thing about this is one of those cancers which
respond very easily to chemo, right?
Yes, chemotherapy. So these are not my role in these is in establishing the diagnosis,
not in removing them. Huh?
Not in removing them. So this is a cancer which requires no surgery, except at times when we have to remove the complete lymph node, because sometimes most of the times a complete lymph node is required to establish a diagnosis. So we have to do.
But you have a role in those that we refer you to. For example, if it's a basal cell carcinoma or it's a squamous cell carcinoma and the sun-exposed areas, a wound that's not healing with rugged edges and everything. So how do you do that?
So there are three main skin cancers. One is squamous cell carcinoma. Squamous cell carcinoma appears in areas of the skin that are already damaged. For example, a burn scar that healed on itself in particular. If there appears, generally patient comes that when I was in 20s, I had a burn that healed on its own, and now it's been 10, 15 or 20 years. Now there is a wound that is not healing. So that should not be left alone. That should be biopsied. This is the most common presentation of squamous cell carcinoma. Squamous cell carcinoma can spread to different parts of the body. Then is basal cell carcinoma. Basal cell carcinoma is a locally aggressive tumor. This appears more on skin, sun-exposed areas. It is locally aggressive. It destroys the adjacent structures, but generally it does not go beyond that. So again, surgery is the main treatment option in basal cell carcinoma. Another thing is a changing mole, malignant melanoma. So if somebody has got a mole and it changes itself
in shape, size, color, texture, discharge.
If it becomes a bit raised, its edges are irregular. It has got a geographical appearance. If it bleeds again and again, so this is a warning sign. So a mole, particularly a changing mole, should not be ignored. If anybody notices any change in the shape of the mole, they should take it seriously, and that should be biopsy.
And they should be visiting an oncologist for the purpose, instead of aesthetically getting it removed by aesthetic physicians who claim to be able to shave it off. I think they're actually doing more damage to the person than doing any good to them, right? So it is very essential at this stage to visit an oncologist and get yourself evaluated and treated for the same. Then there's another condition that's very rampant, that we have a lot of people suffering from hypothyroidism or hypothyroidism, and then they have nodules in their neck and everything. So when does a nodule get, hot or malignant, and what are the options of removing it?
So talking about the thyroid cancer, most of the thyroid cancer patients have normal thyroid function tests. So there appears a swelling in the thyroid that raises the suspicion of the cancer. If there is that nodule is a single nodule, the chances of it being cancer are relatively high.
Okay.
And if the age is in the 50s or in the 20s, the chances of it being a cancer are high. Then if the thyroid function tests are normal, the chances of it being a cancer are high. Then we do a neck ultrasound. On the basis of neck ultrasound, we score what we need. Then on the basis of that, we do the needle test, and on the basis of needle test, generally we are able to make the diagnosis. But if there is a nodule in the thyroid that looks highly suspicious on ultrasound and other factors, and even if the needle test does not pick a cancer, at times we make decision to go ahead with the surgery. Then there are certain hard signs of cancer, that if there is a thyroid lump and there is a change in voice, that is a hard sign of cancer, which should never be exposed. Rather, I would call it a late sign. Then is appearance of the lymph nodes, multiple swellings in the neck, in the area beyond the thyroid gland. These lymph nodes, the presence of these lymph nodes is again a late sign. We want thyroid cancer to be detected before it has gone to the lymph nodes.
So a cancer surgeon deals with this, or an ENT surgeon deals with these cancers of the thyroid gland or the vocal cords? So who should they be going to? If somebody has hoarseness of voice, they have dysphagia as well, and they see these apparent lumps, where do they go?
Actually, we have combined a few symptoms together. If there is a dysphagia, this needs to be initially evaluated by the gastroenterologist by doing an endoscopy. If it is involving the esophagus.
No, not dysphagia, not that dysphagia. I mean swallowing. Difficulty in swallowing. Actually, not
the
dysphagia.
inner part goes to the ENT surgeon. Thyroid goes to the thyroid surgeons. Those surgeons who are doing high volume work on the thyroid. ENT surgeons, some of the ENT surgeons are doing thyroid surgeries. If their volume is high, then it is they are fairly good enough for the thyroid surgery. Then my perspective is that I am a general surgeon with specialized training in cancer surgery. So I had been doing thyroid before, and then particularly focusing myself on the thyroid cancers. So I specialize in doing a total thyroidectomy, that is removing the thyroid gland in total, not leaving anything behind, which is the crux of the surgery that is required to be performed for thyroid cancer. And in addition to that, if required, we are able to do the neck dissection as well. And good ENT surgeons are also able to do that.
Okay. What about lumps on the body? A lot of people have lipomas, and they feel scared that this could be scary. But which lump should they be looking out for? Which lump could be dangerous, like somewhere, anywhere? It could be a tumor, and we are missing out on it, because there are many other conditions that have many such lumps, lipomas, neurofibromas, whatsoever. So which lump should they be looking out for?
So when if there is a patient who has got multiple lumps, generally these are lipomas, these are benign, these are not cancers. So we just need to have a look at them. If any one of these starts suddenly increasing in size, that is a warning sign. Then if any of these is quite big in size, just like 4 centimeters in size or bigger, that should be assessed and evaluated, and we should take that seriously. If there is a single lump that should be seen by the doctor, and preferably if it is more than 4 centimeters, we should evaluate it in depth. So if there are single lumps, should be seen by the doctor and preferably removed.
So when we talk about brain tumors, do you deal with that, or only a neurosurgeon will be dealing with that, or are you able to detect that and refer them or operate them? How does it work?
Actually, that comes under the field of neurosurgeons and radiation oncologists. So generally, a combination of a neurosurgeon and a radiation oncologist, these are the two ideal persons to deal with brain tumors.
Okay, when we talk about tumor markers, how important are they? For example, if somebody has a prostate cancer, for instance, they say, go and get a PSA done. So are these tumor markers in different, cancers? Are they good parameters to detect the cancer or not?
They are good to detect, but the real crux of them is that the real point is that they are very good in monitoring the treatment.
Okay.
So PSA can be used to actually, if it is normal, things are fine.
Okay.
If it is raised, there can be many reasons of that. So tumor marker, if it is raised, it only can give us a clue that we need to investigate further. It can be, there can be many reasons for that. So PSA is one for the prostate, for other organs of the body, like ovaries, we have got a blood marker that is CA1 to 5
Right.
level. It can rise in different conditions as well. But if it is very high, it is suggestive of ovarian cancer. If it is, there are some findings on ultrasound like complex cysts, and there is a raised CA1 to 5, it is again suggestive of ovarian
So when
cancer.
we talk about cancers like cervical cancer or hepatocellular carcinoma, and we have different vaccines for hepatitis B or for HPV, do these vaccines help with cancer or not?
Yes, these vaccines do help, and we have now data of Western world that has shown that the incidence of these cancers have reduced with the vaccination, particularly the hepatocellular, the liver cancer, and the cervical cancer.
And do you operate for liver cancer, or that comes under gastro?
The liver cancer, I am doing some liver surgery to the extent that if there are limited
Nodules or cysts on it?
limited metastasis from the colorectal
Okay.
cancer,
So
then
then
I
you are
am
going to be excising.
Otherwise, generally it is the mandate of the hepatobiliary surgeon
Okay.
who specialize
And
in
the cervical, endometrial and ovarian cancers, they fall with the obstetrician or the gynecologist, or an oncologist operates on them once they are detected. For example, if somebody has a bleeding, breakthrough bleeding later on, and all these symptoms.
What I have seen over the years and my practice, what I learned is that these gynecological cancers are best. What my routine is that I've seen many patients with gynecological cancers, and in this hospital we operate together.
Okay, so it should be a team,
yes.
and there should be a routine pap smear, and all these examinations should be a
So the
routine.
teamwork is working really well for us. So a gynecologist, a surgeon doing the surgery together, following the cancer surgery principles, and we get very good results with that.
Thank you so much, Dr. Kashif Khan. We had with us today Dr. Kashif Khan, who's a cancer surgeon, and he told you how it is so important for you to detect all these symptoms that are going on in your body, to be very well aware of them, whether they are in your body or your loved one's body. Listen to them, heed to them, go to the doctor on time so that he may diagnose them and then treat them and save lives. Thank you so much for watching. Inshallah, we'll meet you next week. Allah Hafiz.